Gavarsa and video.
Okay.
Okay, so start. Shall we start?
Yes, here and you will keep time, no?
Yes, yes.
Yes, okay, start.
Okay. Hello, good morning.
Good morning.
I'm Dr. Tamanna, one of the candidate today. So, may I ask you a few questions if you don't mind?
Yes, yes. Can you please
Uh,
proceed?
you are, uh, how can I call you, ma'am?
You can call me Asia.
Okay, hello, nice to meet you. So, Asia, you are Jack's mom, right?
Yes, I'm Jack's mom.
Okay. So how is Jack doing?
Actually, since we are here for his in weird walk actually, and recently is not able to stand properly since last
Okay.
6 months.
Oh, I'm sorry to hear that. Okay.
Mm-hmm.
I will keep some notes if you don't mind.
Yes, yes, please.
Okay. So, Jack, as you said, Jack has been problem in walking for last 6 months.
Yes,
Acha, how is the age? Sorry, I forgot. What is the age of the boy?
5 5 years.
5 years. Okay. So, Asia, can you just tell me how it started? Just can you describe?
Actually, he was okay till 4 years. He was fine. He was
Okay.
able to do his routine activities also. But like
Okay.
since last 6 to 8 months, we have been noting that like his walking has become you can say he's keeping his feet apart, and whenever
Okay.
he is sitting down, he is not able to stand immediately. He has to
Okay.
he have to take support for standing up, and I feel that he is getting weak day and day further.
Oh, I'm sorry to hear that. Okay, so just can you tell me about his other complaint regarding, apart from this standing or sitting or walking problem, does he have any more illness,
No,
any more
doctor, like he was
condition?
absolutely fine before this it was started also, and we can say this is the only thing which is worrying us. And I have tried to Google on the internet, and I saw that there is some muscular dystrophy. That is the thing which I came across. I'm worried about that.
I can see you are a very keen mother. Just can you tell me about, is any family member affected like this in your family, or Jack's father's family? Anyone?
Yes, doctor, that is the issue actually, which worries me a lot. My brother died at the age of 20, and as far as I remember, he also started having the same problem from early age. And later on, he was not able to walk, and he had later on multiple chest
Mm-hmm.
infections.
Uh-huh.
I'm afraid that Jack will also suffer from the same, doctor.
I'm sorry about your brother. I'm really sorry. So, is there any family member affected, like your father or your sister's son? Anyone more?
No, doctor, as far as I remember, nobody apart from my brother. Like maybe I don't remember in the previous generation.
Okay, okay, that's fine, no problem. So can I ask you about Jack's treatment? I mean, is there any doctor you are now on seeing Jack? Any doctor specialist?
Yes, doctor. Like actually, once this weakness was started, like we went to our GP. Initially, he thought some muscular weakness, so he initially gave some multivitamins and some
Okay,
medication. But like
okay,
after following 3 to 4 times, there was no improvement. So he referred to us here to see a specialist
okay,
pediatrician here.
okay. Was there any special investigation done?
He has done some blood test, and he has said some CPK level is high,
Okay, okay,
and that worries him the most. And on this
okay,
report, I googled and I found that it could be due to Shuns muscular dystrophy.
okay, okay. Okay, that's actually, I know your family must be worried for Jack. And can I ask you that is there any muscle they take or any gene test they did?
No, doctor, they did not do any muscle test or any gene test.
Okay. And was any gene doctor you visited? You and your any family
No,
member
actually,
visited
we did
for?
not visit, but GP said like after the diagnosis of this child, we may have to see gene doctor depending on the results.
Okay. So, do you think apart from this Jack's movement and walking problem, is Jack have any other problem? Like if we start from Jack's memory or Jack's school performance, do you
Yes,
think it is
doctor.
all right?
Yes, doctor. Actually, uh, he had some. I just remember that he started walking late in the initial period of life. Also had
Okay.
some wheezing, for which we have to give him frequent nebulizations.
Uh-huh.
That I think
Okay.
the thing. Those are the only things which I remember.
Okay. So Jack has no, I mean, no problem with feet or
Six
abnormal
minutes,
movement, nothing.
No, doctor. No.
6 minutes finish.
Okay. So do you think Jack has repeated coughs or racing of heartbeats? Any problem Jack has?
No, actually, he's very small to communicate like that. But I don't feel before this illness started, he was very active.
Okay.
And as I said before, he had recurrent wheezing episodes. And one time he was admitted for pneumonia when he was 3 years
Okay.
old. Uh, that is the thing.
Okay. And for last, when was the last chest infection or chest problem Jack had?
Yeah, 3 months back he had some wheezing, for which the
Okay.
GP gave some nebulization, and he recovered in 5 days.
Okay. And then is Jack having any problem like poo and pee?
No, no, nothing like that.
No problem. Okay. And is Jack have a problem like did you see any time any rash to Jack's body, any rash or anything abnormal
Yeah.
coloration?
No, doctor, actually, he had some eczema in early life, and now also he
Mm-hmm.
has some itching over his elbows and back of the knee. But this
Okay.
is since early part of life, not recent.
Okay. So can I ask you a few questions about Jack's birth? Was there any problem before or at the time of birth, or was there any admission after birth?
No, doctor, as far as I remember, there was no problem like that.
Okay, okay. Then, what was, as you said, Jack was a late walker. Beside walking late, what was the age he started to controlling neck and sitting? Can you remember?
Yeah, sitting actually he started by around 12 months. Like holding,
Okay,
I don't remember, but sitting he was late as compared to
okay,
other children.
okay. And walking, as you said, after 2 years,
Yeah,
he
he
started
started
walk.
at 2 years of age.
Okay.
Also,
Was there any
doctor,
speech or,
yes.
sorry,
Also, I would
was
like to
there
tell
any?
you that I noticed that some swelling over his calf area.
Okay, that's very nice to that you remind me. Yes, you notice this is very important point for us. And for how long you notice this swelling
See,
in the
last
cup?
6 months, I have noticed that this swelling is increasing, and also his thighs are getting thinner. That also I have
Okay,
noticed.
okay. So what medication Jack currently having?
Yeah, the GP has given some calcium syrup and multivitamins. Apart from that,
Okay,
no other medications.
okay. And do you think Jack's uh, okay, no. So just can you tell me about Jack's shots or jabs? Is he completed? He's all the
Yeah,
jabs?
yeah, he received all the jabs, including that flu and pneumonia.
Okay. So what actually? How many family members in your family? How many
Yeah,
children you have?
Jack is our only child.
Okay. Okay. And you and your partner lives in the same home?
Yeah, we live in the same home.
Okay. And is there any modification of your home that is made for Jack?
No, 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 not yet. Nothing like that.
Currently, Jack is walking, can walk, or he is some aid. He's some helping aid.
No, he walks, but right now they're difficult in standing. But once he
Okay.
stands, he walks with feet apart.
10 minutes finished. Please summarize your history.
Okay, thank you, Asia. So today I took history from Asia, Jack's mom, who is a 5-year-old grown-up child. And according to mother's history, Jack is a diagnosed case of Duchenne muscular dystrophy at the age of 4, which was evidenced by increased creatinine phosphokinase. And Jack has a maternal uncle who died with the same condition. And currently, Jack has no problem in school in regarding of memory and school activity, but his problem with walking. So he need more support. He needs some aid, which will help him in his daily activity. And actually, I did not find time to ask Jack's social history properly, and I should evaluate is there any social service they are getting or any disability living allowance they are getting. And currently, they are not in any home modification because Jack can still walk and manage himself. And Jack's family needs actually genetic counseling, and they as the Jack is the only issue of their parents. And regarding Jack's multidisciplinary team involvement is very important here because Jack had history of repeated respiratory infection, and he needs support for his daily activity. Okay,
Okay.
this is my.
Mhm. What were the other issues in the current problem?
According to Jack's mom, he had problem mainly in walking now. He cannot himself manage properly, difficulty in going to school and difficulty in daily activity. But as far as mother's concerned, last respiratory infection was at 3 months back, which was relieved by simple nebulization. And there is no further query, there is no further concern about his bowel and bladder involvement.
Okay, so
Um,
now that 2 minute summary is finished. You proceed for the examination.
okay, okay. So, hello, good morning.
Good morning.
So today I'm Dr. Tamanna, one of the candidate today. So I have given the task to examine Jack. Can I see Jack?
Yes, yes, doctor.
And I'm washing my hands with jelly. At the same time, I am making some rapport with Jack. So I believe I'm talking to Asia, Jack's mom, right?
Yes, doctor.
Okay. So Jack, how are you today?
I'm fine.
Okay,
You
thank
are
you.
talking with the
And
examiner.
sorry.
You are talking with the examiner. Yeah, continue.
Okay, okay, okay. So I'm making. I will first make some rapport with my patient, and also I will warm my hand. And at the same time, I'm looking. Is Jack is in any distress? Is any respiratory distress, or he is in pain?
No,
Is there any device surrounding? I mean, wheelchair or any walking aid?
no,
Is there any dysmorphic feature? Because I can see Jack's calf muscle is a little bit swollen. Other than that, is there any
no
feature?
facial dysmorphism.
Okay. And Jack, first of all, I will like to see Jack's gait, how he walks. So I will request Jack to please walk for me and then turn back and then come to me.
Okay, he is walking with feet apart like a broad-based gait.
Okay, I can see Jack is walking on a broad-based. I suppose there is a waddling gait. So I will like to do the Gower's maneuver. Can Jack do Gower's? Can Jack? I will request Jack to lie down and from lying position to sitting and then standing. Can I do
And you
that?
have seen in the video, you have seen the Gower sign in the video as a cue.
Okay. So
Proceed
no
further.
need. Okay, so I can see in the universal queue that there was a Gower sign positive, and I can see Jack is walking with a waddling gait. And now I will like to see his back. So I will take permission from Jack, and I will ask him to just pull up his shirt, and I will request him to touch the floor. So is there any scoliosis on the
No.
back? Okay, and then I will examine Jack's neurological system. So at first, I will see Jack in the standing position, and from the side and the back and the front, I am seeing that his calf muscles are
Yes.
hypertrophied. There is no muscle. There is no muscle injury. There is no muscle biopsy site, and the thigh muscles are atrophied. And then I will like to do palpation of Jack. So I am palpating Jack with the permission, and the muscles seems floppy. And then I will do some. I will ask Jack, is there any pain anywhere in your body?
No. No.
Okay, I'll do some movement. So if you feel any discomfort, please let me know. I'll stop. Okay.
Okay.
Okay, then I will check muscle tone. By tone, I will ask Jack, can you pull up your legs? He can raise his legs above the bed.
Yes.
Okay, then I will see. Can you bend your knee by yourself? He can bend his knee.
Yes.
Okay, so active movements are somewhat preserved. Now I will see the passive movement. So I am giving some resistance, and I will ask him to raise his leg. Can he do this thing by resistance?
Yeah, they can. He can do against some resistance, not full
But
resistance.
okay, so I guess muscle power is 5/6. Then I will tell him, and I will see the tone by doing passive movement of ankle and knee. So how is the tone? I'll do
Tone
passive
is a bit
flexion.
reduced at
Okay,
ankle as well as
and
at around knee muscles.
okay, okay, that's fine. Then I will see jerk reflexes by the tendon hammer, and I'll tell my patient that I will gently tap on your knees. So if you feel anything, any discomfort, please let me know. Then I will see the first. I'll see the ankle jerk. Is it preserved or lost?
Yeah, it's preserved. Reflexes you can
Okay,
see elicitable, but like difficult to elicit, but they are elicitable.
okay. Then I'll check my knee jerk. Is it preserved or lost?
Okay, it's preserved in nature.
Okay, knee jerk is preserved also, but is it reduced or normal?
Yeah, it's not like normal, but it is elicitable.
Okay, then I'll see the plantar flexion, plantar reflex. Is the toes upgoing or downgoing?
How you do plantar?
I will scratch the sole of the lateral border of the sole by a pointed tip of the
Okay,
hammer.
a plantar flexor bilaterally,
Bilaterally, flexor or extensor?
flexor.
Flexors. Okay. Then I will like to see Jack's sensation. And sensation, I will first describe Jack. That Jack, I will touch your parts of your leg. So just can you tell me if you feel anything? Just raise the hand on that side, okay, and close your eyes. Then I will touch according to the dermatome from the lateral border of the both the foot, and then medial border of the both the foot, then back of the leg, then front of the leg, then back of the thigh and front of the thigh.
Sensation normal.
Okay, okay, sensation is normal. In order to complete my examination, I like to do a full neurological examination, including cranial nerves, cerebellar function, and also I like to do cardiovascular examination.
Okay. Okay,
So
so
time is finished or not? 6 minutes is finished long back, I think.
Yeah, no, total I fixed for 8 minute. So you have 45 seconds from the 8 minute. And
Yeah.
now, let's say you have, after this 8 minute, there will be 3 minutes for the discussion. Okay.
so
But
present your case.
examination is 6 minutes, na? Not 8 minutes.
No, it is like 8 + 3. So you at the you can finish 6 minutes, and if you want to start presentation, you can present. You have
Okay,
taken
okay.
a 7 minute and 20 seconds you took.
Okay. So today I examined Jack, who is a 5 years old grown-up boy, and he showed he is not in distress, or there is no device attached to him. On examination, I found Jack has calf hypertrophy and thigh muscles are atrophied, and Jack showed typical waddling gait with on demonstration he showed Gower sign, which is going in favor of proximal myopathy. And on neurological examination of the lower limb, I found Jack's muscles are a little bit hypotonic and floppy, and his tones are reduced bilaterally, and muscle power was 5/6. That means he cannot raise his limbs against resistance, and he has all the jerks are preserved, the ankle, knee, and plantar reflex, but they are not so well demonstrated, a mildly reduced form. And in view of this examination, my provisional diagnosis is a case of proximal myopathy, and according to history and examination combined, my provisional diagnosis is it's a case of Duchenne muscular dystrophy. Differentially, I can think about Becker muscular dystrophy and other myopathies.
Okay, apart from Baker muscular dystrophy, which differential you said?
It can be a case of infectious myopathy, like
Okay.
viral or bacterial, but
Okay.
the family history does not go in favor of that,
Okay. Okay. So why did you want to do cardiovascular examination?
because in Duchenne muscular dystrophy, the most common complication is dilated cardiomyopathy.
Okay.
I wanted to examine
Okay.
the heart to see the
Okay.
dilatation of the cardiomyopathy.
So what will you expect on auscultation?
On auscultation, I will find displaced apex beat on the left and lower position, rather than the normal fifth intercostal space, just medial to the midclavicular line. And also, I may found on the pulse examination, I may find high volume pulse.
Okay. Any murmur like mitral regurgitation or aortic regurgitation possible?
It can be associated with
Yes.
dilated cardiomyopathy, yes.
Yes. So how will you diagnose this case?
By
Already CPT has been done. What is the
yes, if there
diagnostic
is
test?
any out, okay, if there is any aortic regurgitation, I'll find
No,
water
no,
hammer
no.
pulse.
How will you diagnose the Duchenne muscular dystrophy?
Okay, sorry. So, Duchenne muscular dystrophy can be diagnosed. Definitive diagnosis is by genetic testing,
Okay.
by diagnosing of dystrophin gene in chromosome number 21,
Okay. No, it's like X
and
chromosome. It's
supportive.
XP21. Like short arm of chromosome, location
Yeah.
21, X chromosome. It's X
Yes.
linked.
Yes. Yeah.
So,
Yeah.
like, what is the role of muscle biopsy here?
Muscle biopsy we used to do in when genetic testing was not so uh, prominent.
Mhm.
Nowadays, it is actually obsolete because muscle biopsy we can do only when gene study is non-conclusive.
Yes. Yes, it's not absolute. Only when the gene study is not conclusive,
Not
we do
conclusive.
muscle biopsy.
Yes.
So, what advice would you like to give this parent for the further pregnancy? Like if they ask, they want to go for further pregnancy.
Yes, for before going to further pregnancy, I will definitely involve a multidisciplinary team for this family because they need genetic counselor and they need support, also psychological support, and this child needs multidisciplinary care.
Okay, but what will be the incidence of having the next child as a DMD?
Okay, if mother is a definitive carrier, or we can
What do you
say,
think in this case? Mother is definitive carrier or no?
yes, in this case, mother is a definitive carrier because her brother is also
Yes,
brother died at the age of
right,
20.
right. So what will be the recurrence in next pregnancy?
Okay, if he has a boy
Yes.
in next pregnancy, then 50% chance
Okay.
the boy will be sufferer.
Okay. Okay. Can you tell me a few causes of this calf hypertrophy apart from this Duchenne muscular dystrophy?
Causes of calf hypertrophy. Okay, so actually there is a muscle destruction in because of this dystrophin gene abnormality. So this destroyed
No, I'm
muscles are
not
replaced.
asking pathophysiology. I'm asking the what are the differential diagnosis of calf hypertrophy? If you see a calf hypertrophy, what diagnosis? What other diagnosis you will think apart from this Duchenne muscular dystrophy?
Okay, okay, so it can be myositis, viral myositis.
Yes.
It can be abscess, but abscess
Yeah,
bilateral is very rare.
actually it's theoretical question. Like it can happen
Yes,
in limb girdle muscular dystrophy. It can happen in
yes, limb girdle muscle
yeah, it
dystrophy.
can
Yes,
happen
any
as a
kind of muscle
it can be
dystrophy.
physiological, or it can be in hypothyroidism. I think hypo or hyperthyroidism, either of the
Yes,
two.
in
Yes.
hypothyroid. Yes.
Yes. Anybody
Yes.
wants
Good.
to ask any question?
Dr. Tamanna, you did good. Very well.
Yeah, clear pass.
How I did not
Great
finish
work.
social history. That was
Why
very
you
bad.
did?
No,
No, no,
actually,
it's
one thing I would like to suggest here, like everything was good, but this case was the first case of this muscular dystrophy. He's not yet diagnosed. So during summary, we should not say like any modification or any disability allowance. That is not required because he is not yet diagnosed. He has come as a first case. He is not diagnosed case.
Mm-hmm.
So
Mm-hmm.
that was
Okay.
actually
that
superfluous.
is a question of examiner. She has to, as a candidate, directly. She is not supposed to mention this. If examiner asks only, she
Yeah,
has to mention.
like this was
Okay.
only problem. Otherwise, it was very good. Like all questions and everything was like very well prepared.
We have to be more precise in 10-minute history
Yeah, like
taking.
we have to
Mane,
be more attentive to the command. Like what is the command and what was the history? History was as like not diagnosed case. He has a suspected case.
okay.
So we need to present as a suspected case. When examiner asks
Suspect.
like as a diagnosed case question, then I answer as what further social advice you will inquire in history if it is diagnosed case like that. But if it is first case,
Okay. Yes.
then yeah. But that is required actually. You mentioned this point at least that was the learning point for us. That this is required in the history. But history was
Okay.
good. Like I don't think anything missed apart from the social part, but that was also like they were not diagnosed, so it was not that important also.
Will you do
Mhm.
spirometry here?
Yes.
No, no,
Yes.
no,
Definitely.
no, not at this age.
Not at this age, but
Yeah,
Oh.
unless
how
the
to-
respiratory
yeah,
complications start once the child become wheelchair bound, not before that.
he has a wheezing and there was a chest infection. So
But as
just
you
as a
That
said,
could be
prevention.
repeated
routine
wheezing,
Wallry.
na?
That could be routine Wallry, but like DMD cases are prone for respiratory infections.
Yeah.
Hmm.
Yes.
But spirometry only when
Hmm.
there are some that weakness is profound. Like he's still has grade 4 power, grade 5 power in these legs. So
Hmm.
less likely he will have any
Hmm.
respiratory weakness.
Power
But
is a
what
grade
type of
4, maximum power is 5, right? It's not 5 by 6.
maximum? My 6 or 5, I forgot. 6 or 5
Okay.
maximum.
5.
5.
It's a
Then 4
5.
over. Okay,
Yeah,
4
here
over
it
5.
was
Okay.
grade 4
So
against
mention
mild resistance. Like
Yes.
grade
4
0
over
no
5.
power. Like I will share a 6 items, but it starts with 0. That's why it's 5. 0 no power.
Yeah, that's
1
why
is
it's up to 5.
flicker. Grade 2 is movement in the plane of gravity. Grade 3 is movement against gravity. Grade 4 against mild resistance. Grade 5 against like normal movement.
Mm-hmm.
Items are 6, but it
And
starts with 0, so it's 5 total.
and another thing I forgot, upper limb. You have to tell the
Yes,
examination of
yes,
upper
and
limb
you see,
when you are doing
instead of
the limb,
asking to do sensation, you could have tested coordination and upper
upper
limb
limb.
power.
Yeah. Yes.
Yeah.
Okay,
Sensation
so
so far.
let's conclude this meeting, and I think it was good. And so next meeting we will do on Tuesday and Thursday,
Yes,
Mm-hmm.
for me, no problem.
right?
Like
Yes.
you post the
I
agenda
will put
today, possibly.
agenda. One meeting, Tuesday meeting, we will do, I think, one extended and maybe one history we will do. And Thursday meeting, we will do video and
Yes.
communication.
Please. Video. Yes. Video is very. I mean, important now because this is the only station we can get maximum mark.
Yeah,
Yes, videos we will
okay.
do on Thursday and Tuesday. We can do either history plus long extended clinical or short clinicals, 4 short clinicals, whatever, no problem.
Yeah, one extended we will keep, and one either history or
Two short
two. It will
clinicals.
be two clinical. So maybe either one extended and one short, or one extended and one history.
Yeah. Okay.
And we'll not make much of the long discussion, so we'll be
Okay.
able to finish quickly also. Okay.
Okay.
So
Chalo.
Tamanna, video will do like you will run the video, and all will be kind of sort of discussion, but not
Yes.
lengthy
Yes. Yes.
discussion. We don't want
Yes.
lengthy.
Yes.
We
Yeah.
need
Yeah.
a short answer, and that's it, wrong or right. And
See, rather than running video in Zoom, we will send it in WhatsApp. That will be better
yeah,
Yes.
that also we
because it's
can do.
difficult to run on Zoom video. It lots of glitches come.
Okay.
Mhm.
Okay. Okay.
Okay.
Okay,
Chalo, fir.
Okay.
Bye
fine.
bye. Thank
Okay.
Thank
you.
you. Thank
Okay.
you. Bye bye.
Bye.
Yeah.